Hi, Emily. Lots of APD representation in here today. And
My peeps.
yeah, representing.
Hopefully they're not the hagglers. Hecklers, not the hagglers. Hecklers. I don't know what I'm talking about. Is it Friday yet?
Oh, we're almost there. Hi, Eli. Welcome.
Okay, I'm going to go ahead and make an attempt to share my screen.
Give it a shot.
Okay. Oh, my little share content thing is grayed out.
That's because I need to give you them all like a respect. There,
I like the earrings.
there you go. You should now have privileges, Anne.
Excellent.
This actually feels like a real forum with all the people, seeing everybody and where they're from. I like this.
Mm.
Not that it's not a real forum, but an in-person.
There you go.
So Anne, you'll want to start your slideshow from the beginning.
Yeah, I'm actually going to stop for just a minute because I forgot to put my put myself on video.
Folks, thank you for being here. For those of you that are just filtering in, please put your name and where you're from in the chat box. See who we've got here today.
How's that, Rose? Does it look okay?
Beautiful. Hi, Lacey. Nice to see you. Deborah, welcome. Anne, Medford, Grants Pass, excellent. Karen from the Lake Health District. Hi, Karen. Tanya from the Dalles. All right. More from the Gorge, my hometown. Tori from Pendleton. Charlotte from Burns. Beautiful. Welcome. Now people are coming in fast and furious. Name in the chat and where you're from, please, as you have a chance.
Rose, what's the last entry in the chat that you have? It seems like mine kind of stopped.
Yeah, so I think the default is folks are getting a default to me. So if you select to everyone, then you'll see I've got Stacy here from Jackson County Mental Health and Linda from Coquille Valley Hospital. Welcome, Stacy and Linda. Allie from Asante.
Okay, the last entry that I have from the chat is Eli from Pacific University. So at some point,
Yeah, that's because they're coming to me privately.
Okay.
So as attendees, if you select send to everyone rather than to the host, then they'll show up for everybody.
I don't mind either way.
You know, WebEx does some funny things where they do an update and then the defaults are a little wacky. The last session, the default was that nobody could see them. It was really I thought that I was losing my mind, but then Eric sent an ITG thing that said, no, this has actually been a problem for everybody.
You never know what to expect.
Mm-hmm. All right, so we are right at 2 o'clock. Hi, Christy, welcome. Lots of folks from Lake, fantastic. I will go ahead and get started with the introduction stuff and welcome you all to the 2021 virtual series Forum on Aging. This year, we're doing things a little bit different. Instead of having our in-person event in the spring like we do annually, we're going to do a series of virtual events every third Thursday of the month from 2 to 3 p.m. So put that on your calendars. We'll be in the same place, same time. And I would like to begin by welcoming or thanking our partners, GOBI, Central Oregon Health Council, and the Older Adult Behavioral Health Initiative. Without these partners, you know, they really make it possible to host these educations and offer them out to folks for free. It's a wacky time that we're all living in, so much appreciation to them. Will you advance it to the next slide, Anne? So Anne has no conflicts of interest to disclose. I'll just put that one out there for her, and we can move on to the next one. All right, oh, those got squished around a little bit. So to Jana's point here, Jana, all your audio and video as attendees are muted. It cuts down on the bandwidth. We've got quite a few folks on here today. So we're going to interact today using the chat and the Q&A. So chat is just kind of for this fun banter back and forth, introducing yourselves. It does seem like it's defaulting to send your message to me as the host. So do select everyone when you're putting your name in there if you feel comfortable sharing that information. If you have questions specific to the content, please select the Q&A feature. So to open that up, you're going to select these ellipses, and then the chat will populate to the right as well. This presentation is being recorded, and both the slides and the recording will be posted on the Oregon Office of Rural Health's Aging Forum website. And if you would like continuing education credits for this session, I will pop a survey link into the chat box towards the end of the session. Please complete that and provide the identifying information that it's asking for. Next slide. All right, so without further ado, I would like to welcome our speaker, Anne McQueen. Anne is the Community Services and Support Manager with Aging and People with Disabilities program at the Oregon Department of Human Services. And today, Anne is going to speak about not just bureaucracy, but Oregon's Office of Aging and People with Disabilities and you. And I will let Anne get into what all of that means in the next slide. So thank you for being here, Anne, and thank you to everyone who has joined us today.
Thanks for having me, Rose, and thank you everybody for tuning in. I have worked for the state of Oregon for about 7.5 or 8 years, and in that time, a lot of people have a lot of questions about how the system works. And, you know, after being with DHS for 7.5 years, I still have questions about how things work. So what I wanted to do was try to share some information with you that I think might be the most important, or the information that you might use the most in all of your different positions. I know a lot of you work for health department areas, or public health, or universities, or health systems. So I want to try to just give you some resources that I'm hoping you can take away today and use tomorrow. Not the day after tomorrow or the day after that, because it's the weekend, but hopefully you'll be able to use them right away in your job. So again, thank you for being here. I have, in addition to the slides that I have with information on them, I tried to put a few opportunities in there where there's a chance to kind of take a break, breathe, laugh a little bit, and answer a question. So when you see those slides that have a question on it, and they're all simple questions, feel free to type your response into the chat. If it has everyone on it, then I'll be able to see it. If you just end up typing it to Rose, I'm sure that she can chime in and give some of the answers. So we only have an hour, and I want to leave you time for questions, so I'm going to just dig right in. So here's an example of a question. What's your favorite food? So you can type it into the chat. Don't think too hard about it. Just give me the first one that pops into your head.
Ice cream.
Yes.
Heidi and Eli. Pizza, paella, kimchi, Italian, lasagna, fruit, bread. Oh my goodness, they're coming in so fast. Gummy bears.
Cucumbers, that's a healthy one. And huckleberries. Awesome. Give me all the pasta. Wow. I got to go with the summer fruits too, the nectarines especially.
Tacos.
Yes. A couple of people with the kimchi. Excellent. All right. Well, keep adding them in there if you want to, and I'm just going to keep on going. So one of the things that I wanted to just cover a little bit is the objectives that I think we're going to go through today. And if there are other things that you're interested in, I want to leave time at the end for question and answer. And if I don't have the answers, I can certainly get them for you and get back with you about that. So we're going to talk about the basic structure of the Oregon Department of Human Services. We used to just be called DHS, but people were getting confused between us and the Department of Homeland Security. So we put an O in front of DHS, so now people won't think we're the Department of Homeland Security. So we'll talk about that structure. We'll talk about then the different units within Aging and People with Disabilities as a program and what their purpose is. We'll talk about some specific programs that are part of Aging and People with Disabilities and how you can access those or how you can help other people access those. And then talk a little bit about some innovative partnerships in rural communities that help support older adults and people with disabilities. And one that I left off of there, but that I will cover a little bit is how to be an effective advocate, which may impact some of you, or it may be some information that you share with others. Here's a little cartoon. Here's another question. Dogs or cats? Type it in the chat. Both. Awesome. Thank you guys for participating. So here is a kind of simple representation of the Oregon Department of Human Services organizational chart. So we have the director's office, and then there are 5 major programs within the Department of Human Services that serve consumers. So we have self-sufficiency. So programs that help kind of keep people on their feet, get them back on their feet, help them become independent or support their independence. Child welfare, which I know you've heard a lot about in the news, luckily not a lot lately. Aging and People with Disabilities, which you've probably also heard about in the news. Developmental disabilities, so this is the Office of Intellectual and Developmental Disabilities, sometimes called ODHS, and then vocational rehabilitation. So those are the major programs, and child welfare, self-sufficiency, and aging and people with disabilities are the largest programs, but they're all equally important and serve different consumers. Now, if you think about that aging and people with disabilities box, this is kind of how it's broken down. There are other units within aging and people with disabilities than these 4 that I'm showing here, but these are the ones that are probably most important for you to know about. So there's field services. We have a series of aging and people with disabilities offices throughout the state in different cities. And they do all kinds of work. Some of them do Medicaid administration. Some of them don't. Some of them they have APS. They have case managers. They have adult foster home licensors. So a variety of different positions in those field services offices. And those people are all aging and people with disability employees. Then we have long-term care facility licensing. The name of that unit is the Safety Oversight and Quality Unit. So they do the licensing for nursing facilities, assisted living and residential care, and adult foster care homes. We don't license independent retirement communities. Those are outside of our scope. We have adult protective services. Now, I mentioned that field services has APS investigators or APS specialists. The adult protective services that is in Salem is basically the policy wing. So policy and technical assistance happen out of Salem, but all of the APS specialists report up through one of the APD field services offices. And then last, but certainly not least, we have the long-term services and supports unit, which is the unit that my group is part of. So within that unit, there's Medicaid policy, there's a training unit for aging and people with disabilities, there's deaf and hard of hearing services, and then there is the unit that I manage called Community Services and Supports. And the Community Services and Supports Unit does a variety of things. So we do the policy and hold the contracts for the Older Americans Act, which many of you know is an act that was passed in 1965. It's been renewed several times. It allows for things like nutrition, congregate meals, home delivered meals, some of those things. And I'll cover a little bit more of this on a subsequent slide. But we also have the Aging and Disability Resource Connection sort of hub. And I don't know if any of you have heard about the ADRC, but that's going to be something that will be hopefully a really important resource for you and something that you can pass on to others. We also do the Policy for Oregon Project Independence. That's a program for people who don't quite meet the Medicaid financial eligibility, but it's a program that is all general funded. It's not at all federally funded. So it's all state funded, and it helps people with a limited number of hours, less than Medicaid. And there are also case managers who are Oregon Project Independence case managers. So it's kind of a, I guess you could say, a Medicaid light, and helps keep people independent and safe in their own homes for as long as they can be. We also have the Oregon Money Management Program. So there are, I think, 12 agencies in the state who provide Oregon Money Management Program services. Many of them are volunteers, and they're trained to help people do things like pay bills and keep their finances straight. We also, in our unit, support the Governor's Commission on Senior Services and the Oregon Disabilities Commission. Both of those commissions have members who are appointed by the governor. And then finally, we have some other federal programs called the Senior Community Service Employment Program, or CSEP, and the Senior Medicare Patrol, or SMP. So these are federal programs that CSEP helps people 55 and over who are having trouble finding work, does some retraining for them, and then helps them to potentially find jobs. And the Senior Medicare Patrol helps people to choose good Medicare options for them, both Part B and then also for Part D, the medication benefit. So here's another cartoon. And I guess let me know if you can't see these, but I'll assume you can. Okay, winter or summer?
Overwhelming response of summer. Oh, there's a few winters.
And I wonder if that's just because it's the end of winter and we're getting a little taste of summer now.
Everybody's
I wonder what the correlation is between the people who said both cats and dogs and both winter and summer. If these are just, you know, people who love it all, or maybe like me, they're a little indecisive. So I want to stop and actually, well, I'll find out, do you have any questions about things that I've talked about so far? Please feel free to type them in the chat, or I don't know, Rose, can they unmute and talk, or is the chat the best?
The chat's going to be the best, or the Q&A is really the best for questions pertaining to the session. Then I can filter them out of the chat. The chat is pretty fast. Although we've got, where would someone apply for OPI services?
So this is a great question. Somebody can apply for OPI services at their local aging and people with disabilities office, or they can apply at their area agency on aging. And I'm going to talk a little bit about those. So if you don't feel like you've gotten that question answered completely by the time I've gotten through the area agencies on aging and our unit, then just let me know. And I will go ahead and try to answer that again.
See the please speak more about OMMP and how we find out who the provider is in our respective areas.
Okay, let me come back to that because I do have that information. So hold that question. So let's go back to the Older Americans Act for just a minute. So the Older Americans Act is open to people 60 and older, and the real the impetus behind this is to really help people who have great social or economic need, especially people who are in traditionally underserved populations, people with limited English proficiency, and people in rural areas. So the Older Americans Act is really a program that's meant to serve anyone and everyone who's an older adult. Who might need things. And it's not means tested. In other words, there's no eligibility, financial eligibility like there would be for Medicaid, but you've probably seen at senior centers or home delivered meals programs where they say, we suggest a $3 donation for this meal. And those donations help the providers fund the programs. There are also supports to families. There are caregiver supports. So we talked a little bit about nutrition, congregate and home delivered meals. There's also health promotion that is funded through this program. So people who are doing yoga, Tai Chi, there's a whole Living Well series like Living Well with Diabetes, Living Well with other chronic conditions. There's also a title within the Older Americans Act that dictates standards for legal assistance. So every area agency on aging has to have a legal assistance provider that they partner with. Talked a little bit about family caregiver programs. And then I think one of the really important titles is Title VI, which is the services for Native Americans. So there's a certain amount of money. It's a small amount comparatively, but it does go to our tribal nations, and they are able to spend it on various kinds of things too, like similar, to the nutrition, those kinds of things. But it's the rules are slightly different because they're just getting one big pot of money, or one small pot of money. So I want to show you kind of how the funding works for the Older Americans Act programs. So the Administration for Community Living, or ACL, is our federal partner. They get money to us. Usually there is there's some match for that funding, and it depends on what the service is exactly, how much of a match there will be. So we have this funding, and then we funnel it out to the Centers for Independent Living, or CILs. There are 7 of those. Or our area agencies on aging, and there are 16 of those. And then these 3 lines should be connected to the CILs also, but I couldn't figure out how to do that. They have networks of senior centers, health promotion agencies, community-based organizations, and other partners that they funnel money to as well. So the goal of the Older Americans Act is really that not that the area agencies on aging are providing the services themselves, but that they create this network, this web of services to wrap around people in their service areas.
A couple questions have come in, Anne. Do you want to take a pause?
Sure.
Well, let's see here. Examples of caregiver support is one question.
Go ahead.
Title 6 or 11.
And I'm not sure what the question is on the 6 or 11. Title 6 is the bucket of funding that is reserved for Native American populations. So tell me.
Well, the Roman numerals showed 11, she said, rather than 7.
Oh, okay. Okay. So anyway, if there's any question about that, let me know. Oh, it said 11. I'm sorry, I see what it is. I got the the one on the wrong side. I was doing this late last night. So yeah, it's titled. Sorry about that. So examples of caregiver supports. There are a variety of things. So different counties or different area agencies on aging, and I'll actually show you that map here, use their funds for different kinds of things. So sometimes they will have caregiver support groups. Sometimes they will partner with organizations to fund things like the different family caregiver programs, training programs, caregiver assistance programs, and there are a wide variety of them out there. We try to have, they should be focused on evidence-based programs or evidence-informed programs. Sometimes there are conferences for family caregivers that happen. So there's just a variety of things, and it's really dependent upon the area agency on aging and what that AAA, what we call the area agency on aging, the AAAs, what the population of that service area needs. So here, let's see, do people need to qualify for meals to be delivered? So that's like one of the only sort of qualifications. Everyone is eligible for a congregate meal once they start back up. So in other words, a meal site, anyone can go to that meal site who's 60 or over. In order to get home delivered meals, there's a pretty short, simple assessment that goes along that basically is just trying to determine, is the person homebound or is it a hardship for them to come in to get a meal? Now, right now with COVID, it's a hardship for everyone because there are no meal sites open. So right now everyone's getting home delivered meals, who's getting a meal. And so those standards have been relaxed because we just want to make sure that people are getting fed. But that is the only little caveat to that. And it's really, in most cases, people want a home delivered meal because it really is difficult for them to go to a senior center, especially in some of the rural communities where there could be quite a drive. So I hope that answers your question.
We got one in here privately. So if you do have a chat question, do select everyone so that everybody can see it. What's the relationship between AAA community support and DHS community services and support?
I love that question. So if you look at this map, this is the map of all the area agencies on aging. So there are two basic types of area agencies on aging, or AAAs. There are type A AAAs, and those type A AAAs do Older Americans Act programs and Oregon Project Independence. They don't do any Medicaid case management or that side of the house. They only do the Older Americans Act and the Oregon Project Independence. Then there are type Bs, and those type B AAAs do Older Americans Act, OPI, and Medicaid. So pretty much along the I-5 corridor, that's where you find the type B AAAs because there's more of a population there. But in the type A areas, there are aging and people with disabilities offices that do the Medicaid work. Is that clear?
And then folks are really loving these maps.
Oh,
Do you
good.
have the state a website posted anywhere? The slides will be available, but do they live anywhere in particular?
Yeah, well, so I can send some links for where to find these. My versions of them, feel free to, if you get the PowerPoint, hopefully, are you going to send it as a PowerPoint or as a PDF, Rose?
PDF.
Okay. I will try to, because I've taken these things and there's text all around them and I've cropped it. So what I'll try to do is send the maps just as a PowerPoint, as one or two slides that you can have as PowerPoint. So you can pull the image up if you want to, because they are nice to have.
They are.
Yeah. So, oh yes, keep going.
We can keep going, or you can keep moving, and I can save some for later. But since you did just touch on the meals, are there any options for catered to specific diets like diabetes, CHF?
Yeah.
I'm not sure what those are.
Yeah, so my daughter and I do a Meals on Wheels route, and I've learned so much about Meals on Wheels by actually volunteering, things that I didn't know from my job. So there are, I think in different areas they offer different kinds of things, but I think at a minimum there is a diabetic choice and there is an alternate choice. So for example, in the area that we deliver to, there are quite a few people on our route who do not like fish. So there's always an alternate. And in some cases, the meal itself usually is a main dish protein kind of thing. And then they have a vegetable. And then we get a tray that has sides in it, which usually has a roll and a fruit and then a dessert. So sometimes all of the meals are the same because the side is diabetic friendly, and sometimes they're different. But they do have different options. Multnomah County, because they're a large county with a lot of population and a lot of resources, they actually contract with a variety of providers to deliver culturally specific meals. And some of the rural AAAs have done a really good job at that as well. Some of the rural AAAs have also been really smart at partnering with local restaurants to help not only help the restaurants stay afloat, but to also give people meals at a time when it's really difficult. So it's been a nice partnership for those kinds of things. And I have a couple of stories. I've got one story in particular that's kind of related to meals that's kind of a cool one. I think it's also important to note in looking at the options, one of the requirements of the Older Americans Act is that menus have to be reviewed by a registered dietitian, because we've got to make sure that the meal that's being served meets the nutritional guidelines. So whether it's from a restaurant or a Meals on Wheels kitchen, in this area, Northwest Senior and Disability Services has a large kitchen, and they supply meals all around the area. So, but those do have to be reviewed by a registered dietitian to make sure that they. Oh, and there I see. Are there nutritional standards? Yeah. So yes. I think I'll keep going. Is that okay?
Yes, absolutely. There's a couple other ones, but we can hold on to those for a little later.
All right, perfect. So here's a little bit about the Aging and Disability Resource Connection. So the idea behind the ADRC is this whole no wrong door concept. So in other words, no matter what information you need, you can contact the ADRC and they will be able to give you both local and statewide resources for whatever area you're calling from. So the Aging and Disability Resource Connections are housed within our area agencies on aging, those 16, and the 7 CILs. So when you call the toll-free number there, they'll ask you for your zip code, and then it will transfer you to the appropriate area agency on aging or Center for Independent Living. You can also call ADRCs at their own local numbers too. So if you go on to a website for a certain county, they may have a local non-toll-free number you can call. It goes to the same place. And when somebody answers your call, it will be a trained information and assistance specialist. And all those specialists are trained. They have a national certification called AIRS, and I can't remember exactly what assistance information resource specialist or something like that. Anyway, but it's a national certification so that we have consistency and on a level of professionalism with those information and assistance folks. And they're really helpful. They know they have databases both for the local area, and we have a statewide database that our unit updates. So there's the information and assistance service. There's also what I think is really a cool thing. It's person-centered options counseling. So basically, if you or a loved one wants to find out about what resources are available for the long term for their care, you can request to have a person-centered options counselor in normal times come to your house and talk with you about what are the things that are important to you, and they will then try to provide options to you based on what's important to you versus here's all the different things that we offer, choose one. They try to get to know what your wants and needs are and then be able to refer you to those kinds of things. So if somebody, for example, gets options counseling, an options counselor comes to their house and asks them a little bit about what they'd like, and they say, you know what, whatever happens, I'm not moving into a nursing home. Don't want that. That options counselor will take that off the table and not try in any way to steer somebody toward that, because they really want to make sure that that people are having as much choice as possible. So what I want to do is quickly take you to the ADRC of Oregon site. And in order to do that, I think I have to end the show temporarily and switch over. Can you see the ADRC website?
No, we're just seeing the PowerPoint.
Oh.
Are you sharing your PowerPoint or are you sharing your screen? From your share options down at the bottom?
I'm now sharing my screen. Can you see it now?
Yes.
Perfect. Thank you. So this is the front page of the ADRC website. And there are, it's a really great website. It's been tried and tested and retested and revised. There are sort of 4 main areas that you can go to on this website. So you can kind of explore your options. You can do a search for specific kinds of resources. You can connect with your local aging and disability resource connection. And then there are a bunch of tools to help you with planning. Here's some caregiver training from Oregon Care Partners, and that's all free. And then you always have this menu of things, of options down here below. So I don't want to spend too much time on the website, but it's a great site if you are interested in just finding out some information, but you're not ready to talk with somebody yet. And then, of course, the 855 number is here too. So I'm going to close this out. And then go back to the slideshow. Okay, are we back?
Yes, we are.
Smooth. Okay. Whoop. So here's a little joke. And I realize it's really hard to have these cartoons up when there's nobody, like I have no idea if anyone thinks they're funny or not. So we'll move on. Okay, good. Thank you. Thank you. I'm getting an LOL, some giggles, and some ha ha ha. Okay. Yay, thank you. So now, comedy or action? So I wonder, I have to ask you to just put something in the chat if you are one of those people who have answered both to all of the questions so far. Just put a little check mark or a letter or something. I just wonder how many of you are answering both all the time. So, oops. So I want to talk with you a little bit. Let's see, didn't want to be ambiguous. So I want to talk with you a little bit about, share some stories about some cool partnerships and collaborations that have happened in rural areas with our Aging and Disability Resource Connection folks. So the Council on Aging of Central Oregon, or COCO, started this cool program called Caring Connections, and they have phone calls that connect volunteers with older adults. And they're a smaller service area, but again, plenty of people there who were lonely and isolated, and so they now have 40 individuals who are on this program. And I think this is an example of something that's not huge, but it's a really big win in a community. And I think a lot of times we forget how important it is to have kind of these small programs that just serve a handful of people but make a really big difference. And that's one of the things I think that's wonderful about rural communities, is that you can have those kinds of things and they really make a difference. So Northwest Senior and Disability Services is a huge AAA. They serve a ton of counties. I can't even remember all the counties that they serve. They're a great organization, but they have both more urban and more rural counties that they serve. So this one is a cool thing that they did with Food Roots, which is a fresh produce and fresh food kind of organization. And they purchased these things called bounty boxes, which had fresh fruits and vegetables and things like that. And they deliver those to Meals on Wheels consumers and consumers who are receiving Medicaid services in Tillamook County. And it's kind of cool because it assisted the older adults and people with disabilities who got those boxes. And it also supported the local farms. So 211, not 211, 211 boxes were distributed throughout Tillamook County I think over the last season, and I don't know when the season ended. And then Washington County is another one of those AAAs that has both urban and slightly more rural communities. So this particular program with Centro Cultural happened in Forest Grove, and they worked with they used some health improvement grants to purchase tennis shoes for older adults so that they can walk together and socialize safely. So that was kind of a neat thing. And again, this I think this illustrates how the AAAs are really clued into the different populations who are within their service area, and especially some of the more underserved populations, and being able to do something so specialized like this. Again, a small program, but something that that is really impactful in a rural community. Oops. There's another one from Washington County also, and this is the one that I referred to a little bit earlier in the presentation. They purchased some transit vehicles through some transportation grant money that they got from ODOT. And they have fitted these vehicles with electric coolers so they can deliver food boxes to folks who are in isolated areas or people who are homebound. And then once the pandemic is over, they're going to put the seats back in there, take the coolers out, and those same transportation buses will be able to take people to and from the congregate meal sites. So that's sort of cool. One of the trucks is housed at Centro Cultural, which is the organization we talked about in the last slide. And they are serving some migrant camps with some of the meals and food boxes. Rogue Valley Senior Center and Disability Services worked with Jackson County Public Health and a volunteer network to design a vaccination outreach to seniors. This was a really cool partnership between the three of them where they got together, got out of their silos and tried to figure out how to help make vaccines available to people who were homebound and couldn't get to a vaccine center. In this case, over 800 people have received vaccinations through this program, and there are more who are scheduled for appointments. So that's a pretty good one. So I'll stop here and ask you, oh, Rose, good for you. You put in Northwest, all the different counties.
Oh, that was coming in from Naomi, so thank you.
Good, thanks, Naomi. I was gonna say, I can get my map out. I can't remember.
So I have a question from the past.
Sure.
Medicaid application process has changed. Are there people at the AAAs or DHS that will assist people to complete them, particularly if they don't have a computer to do them online?
I believe there are. So what I would do to start is give, what I generally would recommend is give people the number to their local Aging and Disability Resource Connection, because the ADRC will be able to get them to the right person who can help them. And there may also be other things that that person is eligible for or may be interested in, even in the time it takes between, when they're determined eligible for Medicaid or not. So I always think it's good to start with the ADRC. They know the resources in the area, they know who to call and how to get to the people you want to talk to for that.
And coming from Allison, one of their most vexing problems is that many psychiatric hospitals are refusing to admit patients with dementia. Where do we take this concern? Is it DHS? If so, which department? So
this, Allison, is a really good question. There is a group called the State Plan for Alzheimer's Disease in Oregon, or SPADO. They originally did a plan in 2012, and one of the goal groups was to look at what kinds of settings can be helpful for people who have dementia and maybe comorbidities and chronic conditions, maybe also mental health issues. So people who are really challenging to place in our sort of typical settings. We do have a complex case team at Aging and People with Disabilities at APD. Probably you have had some interactions with that team. If not, I can get you contact there, but there really is a problem. They closed the state hospital, and I think there are good reasons for, or not close the state hospital, but close the unit that used to take people with dementia. And I think there are some positive and negatives to that, but it's true. There's really a lack of those kinds of settings. But the State Plan for Alzheimer's Disease in Oregon has a work group that is specifically dedicated to trying to come up with some of those solutions. It's going to be a long process. We've got some folks from DHS who are part of that group. It's being led by a physician I can't remember where he's from, Dr. Aga. But if that's something that you're interested in learning more about or potentially being part of that group, please let Rose know, or let me know. My email will be posted on another slide at the end. But there's not a good solution to that right now. I wish there was, because that's a population that I really enjoy working with and care a lot about, and I just don't think in general we do a very good job. And I don't mean just DHS, but I mean us in general, people who are in the aging network. So.
From Ethan, are there services to help meet mental health needs for these populations, and then adding on to that in their area?
So there are a series, and I think some of these, some of the older adult behavioral health specialists are even on this call, but there are folks who are older adult behavioral health specialists whose job it is, whose role it is to really try to figure out what all the resources are in an area and be able to help refer people back and forth. I think that the number and type of resources that there are in an area completely varies by that area. So, if you know of one of your older adult behavioral health specialists, you can talk with that person. But again, I think that a good place to start is the Aging and Disability Resource Connection. So on their local database, they are likely to have whatever resources there are in the community, where you're interested in, and they can tell you what those resources are. The ADRC is always a good place to start.
And Scott brought up a good point that I think ties into the next question, actually. So senior centers are an important provider in our community. Do you have any idea when they will be able to open their doors again?
Yeah, I mean, it's interesting. We've had a couple of AAA saying, when can we get everybody together? When can we start back with our congregate meals? And DHS is working really closely with the Oregon Health Authority to figure out when it's really going to be safe, what needs to be put into place in order for it to be safe. Will there be a certain number of people? What's the social distancing like? So it's a question that they're wrestling with right now. I think one of the challenges is that older adults who get COVID are much more likely to die from COVID. So they're being very deliberate and careful about when to open back up. And it is a really hard situation, because I think you have the physical health on the one side, but then you also have people's mental and emotional health on the other side, and not having that connection, I think, can be just as detrimental in some cases as, having physical issues. So it is being talked about, thought about, worked on, but we don't have a date yet.
And then adding on to that challenge, folks that don't have computers. So this keeps...
Call that toll-free 855-ORE-ADRC number.
And so that'll take care of also the folks that have computers but aren't able to use them. So reverting back to a telephone.
There also something that I'll mention is the area agencies on aging. The federal government now is doing a lot of there's a lot of money flying all over the place in grants, and almost, I think with the exception of one or two of the AAAs, all of the AAAs have gotten funding and are working on projects that can help reduce loneliness and isolation. So some people are getting tablets, or they're getting internet service, or they're getting computers, or those kinds of things. So if you're if you've got someone, and some people are just getting assistance, so contact the ADRC and find out if there's anything in your area that could help them. A couple of them are even getting electronic pets. So they're really doing some cool stuff. I hope that helps. Okay, I'm going to go on.
Here, yes.
There's a funny power nap or no nap, and I'll let you just think about it, and we're going to move on. So I want to talk just a little bit about APS, or Adult Protective Services, and this is it's a very different unit than the one that I manage, but I think it's really important for all of you to know what to do and what to look for and when to involve Adult Protective Services. So APS specialists who do the investigations are housed in Area Agency on Aging and Aging and People with Disabilities local offices. So depending on your area, you know, they may be at a AAA or they may be through Aging and People with Disabilities. So their policy and training hub is in Salem, but they again report up through the local offices. And about 2/3 of the cases they investigate come from within the community, and about 1/3 of them come from congregate living sites, so assisted living, residential care, and adult foster homes. And one kind of interesting factoid is that nursing facility investigations are done by the nursing facility survey team, and all of those investigators are part of licensing. The reason for that is that nursing homes are primarily federally regulated. There are a few state rules, but primarily it's the Centers for Medicare and Medicaid that oversee the rules for nursing facilities. And so nursing facility surveyors have to have a special certification and have to be trained to do those surveys and investigations in nursing facilities. These are the types of elder abuse in Oregon. The last one, self-neglect, is not something that is generally seen in a facility because if there's neglect happening, it's usually neglect on the facility's part because their responsibility is to keep people safe and away from harm. But the others, you see them a lot. So if you're interested in learning more about those, you can go to the Oregon Administrative Rule 411-020. That's where all of these are listed and they're more defined. I thought it might be interesting for you to see this, and I'm not sure how well you'll be able to see it, but these are the total abuse cases that are investigated according to the county. I don't know that this provides a heck of a lot of information because it really needs to be looked at as a function of how many older adults or people over 18 with disabilities, or people 18 to 60 with a disability there are in the county. So you can look and see, you know, what percentage of that population or how many per that, you know, per the number of people in that county. But this just gives you an idea. And there is an APS data book. I think the latest information is from 2019. So I think within the next couple months, they will be putting the 2020 data book out. Here are some risk factors for abuse. These are pretty obvious. I think they're things to consider when you're working with folks, when you see them in, you know, for an office visit, or when you're, you know, if you're a social worker and you meet somebody. I'm sure you have lots of experience with this, with all of these things. But what I really want to get to is, I think even among healthcare professionals, so I've talked to the Oregon Geriatric Society, some of the geriatric physicians for a couple of years, and we've talked about this. And even geriatric physicians are concerned about reporting to APS and not, you know, if they're not sure that something has happened. So what I want to get across to you is, yes, if you've witnessed abuse, absolutely you'll call. But if you suspect abuse, and it doesn't matter why you suspect it. If you suspect it, contact APS. they'll ask you questions and make a decision about whether there should be an investigation or not. That's not something that you have to worry about. No one is going to get in trouble because there's an investigation and there shouldn't have been. So you can remain confidential. APS goes out if they believe that there could have been abuse based on the things that you've told them. They'll go out and do an investigation, and they'll make a determination. So I think that the biggest takeaway of all these slides about APS is, if you suspect it, if in doubt, report it. And there's this toll-free 855-503-SAFE line that you can call to report abuse of any person. Doesn't even just have to be adults. Any questions about anything I've covered there?
There have been several questions, but we do only have 4 minutes left, so we can ask the questions towards the end and you can keep moving.
Okay. I just want you to see that. And you can decide about singing or dancing. I want to also let you know just a little bit about our licensing so that you understand what kinds of settings are out there, because a lot of people, even who work in aging, don't know of what kind of congregate living settings are out there. So we've got about 135 nursing facilities, about 600 assisted living and residential care facilities. Their rules are almost identical. 200 endorsed memory care facilities. So those have to have, they have a basic license either as an assisted living, residential care, or a nursing facility, and then they have additional rules they have to follow. And then there are about 1,400 adult foster care homes. The policy and the survey teams and the license, the policy and survey teams are out of the central office, safety oversight and quality office. And as I mentioned before, the foster home licensors are in local offices. I will not take you to this tool, but this is a great tool. It's ltclicensing.oregon.gov, and you can search for any facility by the name, by the distance from you, by the type of facility, and it gives you the provider's contact information, but you can also see the latest survey results. You can see if they've had violations of Oregon administrative rule or abuse. You can see the severity of those violations. You can see if that facility has had some kind of notice, like a condition on their license, or a license revocation. You can also see what kinds of fines they've paid for violations. So it's really handy. And if you are ever going to help somebody, find a place, you should totally look at that website. So if you're splurging or saving. And I want to just talk for like a minute or two about how to advocate successfully. It's really important that you recognize that state employees and agencies are neutral state partners. We cannot have an opinion about a bill or or a concept unless it is endorsed or not by the governor. So we all serve at the pleasure of the governor. So if she doesn't say that she supports something, we can't support it as state employees. I think it's also important for you to recognize that we can't make rules on our own. I've had a lot of people come and say, well, can't the state do this? And really, the state can't do much unless there is a statute or a rule that we have to abide by. So if you or someone you know is interested in getting some kind of law passed or changing a law, the best thing to do is go to the legislator in your area, because they really listen to constituents. We can talk to them about all kinds of facts and figures, but if a constituent goes to them and says, here's what I believe and here's why, they are much more likely to do something about that. So legislators and lobbyists are the ones who generally create the bills and the concepts. And then here's just the little way of how it reminds me of that, how a bill becomes a law. But so if a bill is passed by the legislature, then it becomes a statute. then the policy analysts within the department will draft rules based on that statute and what the legislative intent or what they believe the legislative intent behind that statute is. And then rule advisory committees meet, and they include people who are interested in those kinds of rules. If you or someone you know would like to be on the mailing list to hear about what rule advisory committees are coming up, to see if there's something you're interested in, let me know or let Rose know, and we'll get you on the list. And that just means that you'll get announcements. And if it's something you're interested in, great, you can attend it. And if not, you can just delete it. But that's a really big place to make an impact. You know, when consumers show up to rule advisory committees, they are listened to. We always have a lot of lobbyists and you know, and those folks show up, but it's really important to have people who are constituents and citizens. So then draft rules get revised based on the feedback, staying true to the statute, of course, and then that's how an Oregon administrative rule is developed, and then that's how we govern, you know. So I think we're close to being out of time, so I can answer other questions now. And
so if folks want to stay on for a couple extra minutes, we can do some more question and answer. If not, I will pull the questions that we didn't get to out of the chat and follow up with you. Work with Ian to get some questions to those. And then I did post in the chat a link to the evaluation, as well as a link to our events page. There's a couple of upcoming virtual learning sessions from our partner organizations that I want to draw your attention to. So if you have a moment to go check those out and complete the evaluation. So just going through the chat box here.
As you're going through that, I'll just let you guys know if you have any question at all that didn't get answered or you want more detail on, please send me an email. And if I can't answer it for you, I will forward it to somebody who can. I want to make sure that you feel like you know where to go when you have questions, because it's a big, clunky, complicated system.
Thank you, Anne. So if Daniel is still on, Daniel's question is, does the process of reporting suspected abuse, neglect of elderly or persons with disabilities vary from county to county?
For the most part, no. APS specialists are trained to do the same thing throughout the state. I actually do a short presentation for APS fundamentals on dementia, and they all get trained the same way. There are a few things here and there that may differ, but the rules are the same, and the process of investigation are the same. They should be the same.
Beautiful. Is the funding for the community services and supports program based on the population of the selections, or is it equal for all sections? Sections. It seems that the funding for OPI is never enough to help enough seniors.
Yeah. So there are kind of two questions couched in there, and they're both really excellent questions. The Older Americans Act funding is based on the number of people living in the state. So we get this big pot of money, and then we have what's called an intrastate funding formula. So every area agency on aging has a certain percentage of that money that they get that's based on this formula that has to do with their population, and the percentage of the population they have in their service area. So that's how Older Americans Act funds get distributed. For Oregon Project Independence, the area agencies on aging can choose to offer different kinds of services within Oregon Project Independence. So there are some service areas that have fewer consumers, but they spend a lot more money on those consumers. And then there are other area agencies on aging that spend a little bit less money per consumer. Sorry, there's a lawn mowing right next to me. What timing? So some of them will spend less and be able to serve more consumers, and it just varies, according to the money they have and the number of people who are requesting services. So but it's true. You know, I think Oregon Project Independence is always like the first thing on the chopping block. The good thing is, I think we finally gotten to a point where I think the legislature really recognizes the benefit to it, and hopefully we won't get it chopped again.
And then what is the best practice to get someone set up with assisted living for either caregiver or assisted living?
So what you'd want to do is first contact your ADRC. That's the best place to start, that 855-ORE ADRC line. And they will refer you to, depending on what your situation is, they'll figure out if you are eligible for financial assistance, or if you can pay for part of it on your own, etc., and then help you, potentially with some options counseling if you're not sure what type of care you'd like to have. Oregon is great because we are one of the states in the union who has the highest percentage of Medicaid consumers who choose to receive care in their homes, and that's what most people tend to want. So we're in a good state for that.
All right. Let's do two more before this up. That's possible. I'm interested in the availability of homebound psychological services for rural elderly. Who is the person or agency to contact to learn more about this subject?
I'm going to sound like a broken record. Guess what I'm going to say? Start with the ADRC. Different areas will have different resources, and the information and assistance specialists will be able to use their database to try to find something that's close to what it is you're looking for, but there will be different resources in different parts of the state. And you may get referred to the older adult behavioral health specialists as well.
Yeah, thank you, Kathy. Trolls is a good one. And then the last question here, any inpatient patient addiction treatment options for seniors or disabled with needs? I find it incredibly difficult to find support as treatment centers can't help with ADLs.
Yeah, that's a thing about our system that is that's not the way it should be. It's kind of the same with mental health. If people have a primary mental health diagnosis, but then they need ADL care, a lot of times we end up serving them in aging and people with disabilities because we'll do ADL care, but mental health facilities don't tend to. I, again, would recommend you contact your ADRC and ask that question, because different parts of the state are going to have different options. Hopefully your part of the state is one that will have something. I think within, I want to say the self-sufficiency program may have some options as well. But the great thing is the ADRC is going to have those resources. So I wish you luck. That's a hard one.
Fabulous. Well, yeah, I don't think I've been in a session that had so many questions, or about half of participants staying on for 10 minutes afterwards. So thank you. That was obviously much needed and much appreciated by all. Many thanks coming in, and much appreciation. So thank you for joining us today, Anne, and everyone else who participated so much. It was a pleasure to have everyone.
You're very welcome. Thank you guys for being such great participants, and please use my email address if you have any remaining questions. It's been great to talk to you. I hope it was helpful.